Good morning. Happy Valentine Day. I am Dr. Atar Rahman Khan, consultant in internal medicine. I hope most of you guys have already taken COVID vaccine. COVID vaccine has two shots. If you take the vaccine today, another vaccine should be taken within 3 to 4 weeks or a little longer. But remember that this vaccine is not going to protect you 100%. Any vaccine efficacy is 80 to 90%, but this COVID vaccine has 90 to 90% as per experts. This vaccine you're gonna take two shots, like I said, 3 to 4 weeks apart. Once you took the vaccine, you may be afraid to have some kind of side effect, which is also fairly common, but it's okay. The signs symptoms are very mild, which disappear within a few days. Injection site pain, fatigue, headache, sometimes muscle pain, and also you could have fever. If you have this kind of responses from your body, it indicates that you have the vaccine and the vaccine is working. It stimulates your immune system, and which is manifested by this kind of clinical features. Don't worry about that. If you can tolerate the pain and aches or fatigue, that is good. If you cannot, take some acetaminophen or ibuprofen, but do not take it prior to your vaccination. Also, be mindful that if you are drinking a lot of alcohol, do not drink alcohol few days before the injection and 2 weeks after the vaccine, so that your body's immune system is friendly with you and can produce the antibody that you are required. Once you finish the vaccine in 2 weeks, two shots of vaccine, then you are fully immunized and your immune system hopefully will work better. However, you are still at risk for coronavirus infection. Recent report from California indicate that one guy has vaccine, and he completed his vaccination, two shots, then he got the infection. And this is a rare case, but is not very much bad news. As we said, that vaccines does not give you 100% efficacy. Still, you have to exercise your precaution, like you have to wear mask, you have to make a social distance, you have to maintain your hand hygiene. These are the things you must do, and also this is an opportunity to keep yourself healthy. Drinking a lot of fluid, eat plenty of fruits and vegetables, so that your immune system is working and up and running. In rare case, there is an anaphylaxis reaction which you should know. 1.2 million people have received the vaccine. Only 21 people have demonstrated anaphylaxis reaction. This anaphylaxis reaction was treated, and the patient all are recovered from the reaction. If someone has an anaphylaxis reaction in first shot, then do not take the second shot of COVID vaccine. COVID vaccine anaphylaxis reaction is from COVID or component of COVID vaccine. Anaphylaxis reaction is extremely rare. You should not be afraid of it. Those who have an anaphylaxis reaction in the first due to vaccine or peanuts, shellfish or other things, other allergens, they are better off to carry epinephrine shot auto injector with them, so that if there is an anaphylaxis reaction, they can take care of it. However, it is prudent to stay in doctor office at least an hour. Anaphylaxis reaction is demonstrated by severe hypotension, dizziness, nausea, vomiting, urticaria, swelling of tongue, swelling of throat, wheezing, respiratory difficulty. It is potentially fatal condition, so we have to be alert. That should not preclude you from getting the vaccination. Remember that this pandemic is far from over. Sometimes there is a delayed allergic reaction, like 5 to 10 days after the shot, muscle pain, body pain, and fever, but these are not too difficult to deal with that. CDC provided a app. The name is V like Victory, vsafe.cdc.gov. If you have side effects from the vaccine, you can report it through this app, so that CDC are tracking any kind of untoward reaction to the vaccine or vaccine component. Although vaccines are given before vaccine is executed to the public, it was tested many times and got the approval from FDA. Federal rule to make COVID vaccine to all individual free in the United States. In the country where I live now, in Bangladesh, vaccines are given free, and the people who lives in Bangladesh, they must register to the government website surakha.com with their national ID. Then they will be informed when and where they can get their shots. I hope this vaccine side effect information is helpful to you. Kindly be informed that vaccines are not a guarantee, so you have to exercise your precaution. Like I said, hand washing frequently, wear the mask, and make social distance. Thank you so much for watching the video. Please give a like, subscribe, and comment if you have any, and share this information to your friends and families. I will be back soon. Thank you so much. You have a wonderful day.